Welcome to the Bright Eyes Podcast, advice for healthy vision for all ages. Your hosts are Dr. Nate Bonilla-Warford and Dr. Beth Knighton, residency-trained optometrists providing eye care to all ages with exams for glasses and contacts and specialty services including vision therapy, myopia control, orthokeratology, and sports vision training. Their mission is to empower patients by providing the best in friendly, professional, and individualized eye care.
From rainy Tampa Bay, Florida, it's the Bright Eyes Podcast. This is episode number 16. I'm Dr. Nate Bonilla-Warford, and today's episode is all about children and computers, specifically children's vision and computers. Now, about 7 years ago, I wrote a blog post about my love-hate relationship with Minecraft. And the reason why I wrote that was because so many of my patients who are children were talking about Minecraft incessantly. They would come in wearing Minecraft shirts and Minecraft shorts and Minecraft shoes. And because I was encountering it so often in the exam room, I checked it out. And this is what I thought. Minecraft is great for stimulating community and creativity. It is very, very cool in that regard. But it can create a lot of eye strain from hours and hours of computer use for kids and adults. So fast forward to 2021, and the COVID-19 pandemic is still an issue in our lives, and many of our patients have been e-learning. I have one child who's still e-learning at home. The other one has gone back to classroom school. But one thing I've noticed is even the kids who are in the classrooms are using computers and devices more than ever before. And this gives me a little bit of anxiety because I've spent the last 10 years trying to educate parents and educate children about the proper ways to use devices and computers to limit visual problems. And starting about 5 years ago to 2 or 3 years ago, I really started to see a lot of improvement in parents understanding that they do need to set screen time and digital device time limits, and that was making a lot of progress. And so I was seeing a lot of progress in that regard, and it was pretty fantastic. Well, now with the pandemic, all of that is out the window. And so now I am talking about this all day, every day with even more intensity. So early on in the pandemic, when most of my patients were doing either like virtual learning or e-learning or homeschooling or some version of that, I was looking around for an authoritative guide that had been put out by one of the organizations specifically to address the proper ways that children should use computers for e-learning to limit visual strain and reduce the likelihood of visual problems. And as it turns out, I couldn't really find something that was exactly as comprehensive as what I was looking for. There was lots of different pieces of information out there, but they sort of weren't in any one place. So I spent quite a bit of time putting together a guide for e-learners to reduce visual strain and vision problems. And what I figured out right away is it's really important, this information, for e-learners, but so many children are using computers in the classroom, like I said, that it's not just for e-learners. In fact, this information is really good for children of all ages who are in any sort of educational program because most of them do use computers on some level. So what I'm going to do for this podcast is go over the guide that I wrote for e-learners, keeping in mind that it is applicable to almost all children these days. Now, of course, I'm going to put the link to the guide in the show notes, but you can find it right here at brighteyestampa.com/e-learning-guide. So let's dive right in. So why is this guide important? It's important for two reasons. Most people understand that children or adults who work extensively at a computer for either their job or school are at risk for having different types of visual problems. And those problems can be eye strain, they can be headaches, they could be blurred vision, they can have feeling of dry eyes, they could have neck or shoulder issues if their workstation isn't set up properly. And so those are all of the short-term problems that children can have. However, there also are long-term problems that children can have. There's a lot of discussion right now about the pandemic causing a significant increase in myopia, which is the scientific term for nearsightedness. The reasons for that are complex. Some of them have to do with genetics and genetic susceptibility, but a lot of it has to do with staying indoors, not leaving the house, and using devices both for school and for recreation, like video games and Minecraft, but also for social time. It's very, very important for children to have social interaction with their peers. And right now, for many children, that's not really possible. And so using social media and playing games that are social is important for their well-being. However, taken to excess, it can cause vision problems as well. So that's why we are talking about this. All right, so what can you do? Number one, have the right setup. In the very beginning, parents were scrambling to have any sort of device they could so that children could have access to school, whether it was a laptop or an iPad or whatever. But in general, when they're working at a computer for any length of time, whether it's for e-learning at home or whether it's for homework at home or whether it's just for other use, here are some tips that can help you set up the children's workstation better. So as far as screens go, screens are so much better than they were back when I was a kid. They're larger, they're flatter, the lighting is better. It's just better in general. In general, the bigger the screen, the better. So if you have or can afford a larger screen, it's easier for the eyes. And for children, and if you have a larger screen, it allows you to select slightly larger magnification to make it easier to see small print. You want to position the screen so it's mostly straight ahead, so they don't have to position their head in a weird way to be able to see it. Chairs should be straight with back support. If they can't touch the ground, they should have a footrest. You want to have some sort of natural lighting, ideally near a window. And it's nice to have a water cup so they can stay hydrated, and try to keep it visually organized so it doesn't get too distracting. Now, posture is one of those things that's very, very important, but also very, very difficult to get kids to maintain. But as a general rule, the back should provide support. The feet should rest on the footrest, like I said. The chair shouldn't swivel or wiggle and they get too fidgety. And they shouldn't have to put their body in any particular odd position. And the wrists should be neutral, not flexed up and down. So here's a question that I get every day. Do children need computer glasses? And it's not surprising that the answer is complicated. So there are lots of different reasons why we prescribe glasses for children. Sometimes they just can't see very clearly without their glasses. They might have nearsightedness, they might have farsightedness, they might have astigmatism. And so what we do is prescribe glasses to help them see clearly. And most people kind of understand that. However, there's a whole lot of other reasons why we might prescribe glasses. They might have binocular vision problems, meaning the eyes don't work well together, or they might have focusing problems, that their eyes don't accurately look at the screen. The autofocus system of their eyes, just like the autofocus system on your phone's camera, might not be working very well. And so doctors like me or Dr. Beth or others might prescribe glasses specifically to help with the focusing problem, to make the focusing more accurate, and that can reduce symptoms like headaches and blurry vision. Also, children may be able to focus visually on the screen perfectly fine for a while, but after 10 or 15 minutes, they start to get fatigued and sort of lose interest, and so the glasses can help sustain their visual attention if they have problems. Sometimes the glasses need to be very special type of glasses with either something that's called prism or some other types of adaptations so that the glasses help them to see the computer as best they can. Now, this is complicated because there are some times where we prescribe glasses for the computer that helps, but it actually makes distance vision blurrier. Adults are pretty good about, okay, I'm going to sit down, I'm going to work, I'm going to put my glasses on, and now I'm going to get up and I'm going to walk around and take them off. Kids aren't so good at that. And so it becomes a little bit complicated, and so definitely take the advice from your doctor, your child's doctor, about how glasses should be worn. Now, another question that I get asked every single day is, what about blue light? In the beginning of the pandemic in 2020, there was a huge surge in interest in blue light protection, and lots of people were buying them on Amazon, and they were kind of wearing them full time. And so I get this question a whole lot. And the truest answer about blue light protection is we don't fully know or understand, so it's hard to give people guidance because it's a newer topic. So here's the theory. Devices emit light, and some of that light can be harmful. Now, we know that ultraviolet light from the sun is harmful, and that's why our glasses and sunglasses have ultraviolet protection. But there's newer concern that the blue light from screens may be harmful. And this came out originally, there was some scientific research where scientists in a lab bombarded some petri dishes with different cells and noticed that if they used high-intensity blue light, that those cells were damaged more quickly. And then that sort of sparked this whole concern, like, oh my gosh, maybe all of this device use, screens and computers, were making us all go blind. Well, after that was examined more closely, we realized that we get way more light from the sun and other sources than we do from screens. So there's really no concern about screen use causing people to go blind, and therefore no reason to use blue light protection. However, there are some reasons why people might benefit from blue light protection. One, there's absolutely research that shows that circadian rhythm, which is what helps us get to sleep at night, can be altered if you don't get enough blue light or if you get too much. And so that can be helpful. Blue light protection, especially towards the end of the day, can help people sleep better. There is some evidence or some reason to believe that blue light does cause eye strain, so that does help people feel a little bit more comfortable, but it's very specific. I don't think every single person needs blue light protection or blue light protection glasses, but some people really do benefit from it. So that's something that you can talk with your doctor about. Now, we are at one of my favorite topics, and that is visual hygiene. It sounds like you're washing your eyes, but it's not. What it means is taking breaks, making sure that your eyes can function normally. Now, there's two different ways to approach this. For a long time, there's been something called the 20-20-20 rule. And what that means is every 20 minutes, look 20 feet away for 20 seconds. This lets the focus of the eyes relax. This is more to keep your eyes feeling good. By taking the focus away from up close and looking at least 20 feet away, even better if you can look out a window or even further, that just sort of keeps your eyes kind of working. However, there's a newer rule based on some scientific research that says it takes a full 5 minutes for the eyes to fully relax after spending time at the computer. So every hour, take at least a 5-minute break and move around. It's even better if you can go outside and move around. But what that does is it lets the eyes fully relax at least once an hour. Now, I mentioned going outdoors. So that is a really great thing, especially for kids who are e-learning, but also just in general. And I'm going to say why. First of all, you're more likely to be a little active and get some more exercise if you're outdoors rather than indoors. But also, there's extensive research on this, and we did an episode in the past, and we'll link it in the show notes, that says that children who are not myopic or nearsighted, but who spend a significant amount of time outside each day, more than like an hour and 15 minutes on average outside each day, are much less likely to become nearsighted. So not only is it good for your brain and good for your mood and good for your muscles to get outside, it's also good for their long-term health. Now, these are all suggestions, not just for e-learning students, but also just for any student who is using a computer, whether it's at school or whether it's at home. Keeping good posture, having a screen set up correctly so that they're not too close to it, so that their neck doesn't get uncomfortable, so that they take breaks, they wear proper glasses. All that's important. If they're having problems, if they're having symptoms, if they have trouble using a computer, then it's really important to go to an eye doctor who is familiar with children's vision and make sure that their eyes work the best possible way they can. You can certainly come see us. We would love that. You can also find doctors who are very good at this sort of care. I will put some links in the show notes to both COVD, the College of Optometrists and Vision Development, and the American Academy of Orthokeratology and Myopia Control. They are also very, very good. Obviously, this is not an issue that is going to go away. As technology advances and as the curriculum in school becomes even more technology-based, whether it's iPads or whether it's computers, all of these issues are going to stay with us for a long time. And so it's helpful if we are able to make sure that our children have good habits so they can meet their needs. So as the work gets more visually demanding in school, they are able to adapt and succeed. Sometimes more than just ergonomics and glasses are necessary. Sometimes we have to do vision therapy to help children with problems that they either have or that they've developed. Sometimes we make referrals to occupational therapists or other sorts of doctors. So just continue to keep in mind that this is not an issue that's going to go away. So I hope any of that was helpful. I'm very excited about some of the upcoming episodes that we've got, and I hope you have a wonderful day. Thanks.
Brought to you by Bright Eyes Family Vision Care and Bright Eyes Kids. Find previous episodes and more detailed information at brighteyestampa.com. Creative Commons copyright attribution, non-commercial use. The only purpose of this podcast is to educate and to inform. It is no substitute for professional care by a doctor experienced in the area you require. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Please consult your physician for diagnosis and treatment.